way of, getting people screened and tested. I really admire the way they organize that. But what the problem I had, and a lot of people too have, I expressed that was they our arrival room is so small to accommodate all the passengers as well as the staff of the airport staff and public health of staff. So the space is so small. What they haven't done, I hope they've done that, is to limit the number of people who enter to do their screening and test. That way, people will feel confident that you're in a safe environment. But that area was a complete chaos in terms of the number of people who were all packed like sardines, squeezed up on the line. There's no social distancing. And of course, the people have the habit of wearing the mask halfway, either under their chin or just on their mouth. So that was something that I observed all around. Very few people had their masks fully covered. People who collecting data, but some of the people who standing around talking, giving instructions, there's just yelling. There's so much noise, and I mean, for me, it was so toxic for me, the noise and the jam-packed area. But overall, the way they are organized, the screening and data collection is so unique. But another thing is, I'm sure
Dr. Golafale, when you say the place was...
Let me just end up, Mr. Tyler will come on that on the proximity of the sample collection area and that of the crowded room where everyone's talking and the place is not fully ventilated, and you have, it's kind of hot in there because of the number of people. So I'm sure Mr. Tyler may want to comment on that, on the issue of and confidence in the sample collection and all that. Yeah, you wanted to say something.
Yeah, no, I wanted you to describe when you said the place was crowded. How many persons you talking about here, and what the size of the room is? Or you're talking about the terminal? Which part of the airport you're trying to describe here? Where the place was crowded?
So the arrival, I'm not sure whether it's the arrival. When you arrive, there's just one entry point.
Okay.
To exit terminal where you have to go through immigration and all that.
Right.
So when you go through that, there's a room before you go to the immigration desk, and you have to the immigration desk is downstairs. It's a new airport, so there's a room there. I'm sure it was just used for people to pass through and get down, but now they are using it for their whole COVID screening. So it's a very small area. And I mean, you can utilize that area if you have people waiting outside. Just have a little canopy or somewhere people wait and sit, and create distance. Make the environment more conducive for people to move in freely. Limit the number of people who go in. That is that's one of the poor work I saw at the airport. There is no regard for social distancing. The public health protocols are now well observed, especially for people wearing their masks properly and all that. And overall, I think I saw more interest expressed in the fees that were being collected, because they have a very strong security measure on people paying. It's been verified by at least two checkpoints are set up to verify that you pay that money. But they aren't putting effort in ensuring public safety when they enter. And even for the staff that work there, people talking and yelling all over them is not safe, and they have to put in place a proper mechanism to avoid overcrowding in the departure terminal where all the screenings are going on.
Abby, any comment?
I mean, he just spoke to what I was about to say, making sure the whole point of doing the testing is to get people, get the test results done as soon as possible and let people go on their merry way. But at the same time, the most important part is not to get as many people infected, and the secondarily, because you have so many people like packed up in one room. That's totally defeating the purpose of the whole getting tested, because you could come there negative, and just by being exposed in a small room where you have body temperatures, you have people yelling, and yelling and talking to each other. I mean, everything is aerosolized, so it's in the air, and people sitting there. So you're gonna have more people getting sick, and their test results may come out negative within like maybe 72 hours, 48 or 72 hours. But that just means like the viral load in the body is not high enough for it to be detected on the test results. And even when we tell people the test results say it's negative, but that doesn't mean you're 100% negative, and we continue to tell you to do all those many things that you need to do to keep yourself safe. But if you're not going to have a room that's safe for people to have the test done and be safe and leaving from there, then that's defeating the purpose. That's all infectious disease and public health combined there to know you. Just, basic that you should know that. Even that's why when the doctor's office, when we started having people coming in for appointments last year, during the height of everything before it closed down, and even after they opened up, we said the parking lot was the waiting room. Stay in the parking lot, and then you come inside. We'll call you one by one, call you one by one. So that's the most important, not to get other people infected.
But before I go back to Saki has Dr. Golafale is here with me, so I'm used to calling Saki. So Saki has taken his vaccination. It's been 1 month. His immunity has kicked in. Should he battle about all these things, or he should just go his merry way because he's already vaccinated? Why should Saki worry about getting infected again if he's already vaccinated?
You should always because they tell you that the makers of the drugs, the manufacturer of the drugs, tell you that nothing is 100%. Even though you have immunity, nothing is 100% immunity. There's no 100% immunity exact. That's the whole thing about science. It's not so exact to where we can say, oh yeah, you got the vaccine now, so you can just go ahead and do everything. We always tell people, you get your vaccine. That doesn't mean you running around. Yes, you can take your mask off, but just common sense will tell you, you know what, just a couple of months ago, these people were not, weren't doing all these things. You shouldn't go back to the old normal. This is a new normal that we're living, the world that we're living in now. You still want to make sure that, okay, maybe I shouldn't go to that basement party where 10,000 people are going to be sitting there. And if I'm there, I should try to get out a little bit so I'm like getting myself exposed into the regular air. And you always have to remember, not everybody got vaccinated. So that person and if you have some risk factors, you have pre-existing conditions that make you more susceptible to getting any kind of respiratory disease or anything like that, you want to make sure you're taking extra precaution to keep yourself safe. So the vaccine is not a be all and end all. You still have to follow certain precautions to keep yourself and your family safe.
Dr. Golafale, now they collected your $75. Testing is next. Walk us through that.
Well, yeah, I did a test, and for me, I worked in the laboratory setting for over 15 years, and I have learned a lot about quality, and quality is something that we all need to work towards, ensuring quality in all aspects of our work, especially in the medical science area. And sample collection is, especially for biohazard, safety measures are key. You have various biosafety levels to ensure that when you collect samples, you yourself, you are not at risk, and that's one of the things, a lot of the things we can't just talk it right here, but I would really love to have the National Public Health Institute, those involved with the sample collection process, to make sure that people are protected and the environment where samples are collected is far from possible toxic air or contaminated air environment. So that's one of the things, and also it's here that when you go for tests, you have a drive-through process going on. They're doing that to ensure no contact between you and the person collecting the sample, to save the people. And Liberia is a challenge. Of course, we don't have that, but the sample collectors, like, you don't initiate conversation with you and the person you're collecting sample from. because mere fact that I bring my nose mask down and you gotta ask me how you doing, how your trip, all those things are not necessary, especially when you are not fully, you only have one thing, nose mask on, collecting sample. You come there, collect the sample, you just give instruction to the person, you collect the sample and move on. So that's one of the things I think I observed, the too much, talking with the person you're taking the sample from. You want to ask them how you doing, how is the trade, and welcome to Liberia. I mean, Miss Tyler can come in with that on how she thinks,
So
yeah.
wait, the people who are collecting the sample, the specimens, the ones who are working in the place, are they not wearing their N95 mask and the shield? Are they not?
Yeah, they're wearing their masks. You see them wearing their masks.
Are they wearing the N95 mask or just a surgical mask?
It's some surgical, and the one I encountered were wearing a surgical mask.
Okay, so anytime you collect an example, you should have on your N95, and you can have the surgical mask over it too, and you should be wearing the
Yeah,
shield.
they're wearing their shoes. They're wearing their shoes. But
Okay,
what I'm saying is that the entertaining conversation
yeah,
is,
that should be like kept to a minimal. It should be kept to a minimal.
yeah,
Like, how
I
you
told
doing?
them,
Fine, okay. So
yeah,
verify
good,
the name and
move on.
birthday, get it and move on. What I
Yeah,
would suggest is like they could have people sitting in the open area, part of the airport, where they're doing the testing, having people just kind of float right in. Okay, you come and get your stuff and float right and come just like that. Just have it revolving quickly. So that way, people are not standing in a small room, and then there should be no look. I know our Liberian people, you like to have conversation and all
yeah,
that. But like I said, we're not in the old normal anymore, and
no,
certain cultural things will have to be put to the wayside. Like
exactly.
go and verify the name, birthday, get your test done. See you later.
Move
Anything
on.
to minimize that delay should be put in
Yes,
place.
yes, exactly.
So you did a test. Now you are. Then what?
Well, once you
And
do
what
the
is this
test,
test look? What does the test look like? What is collected?
well, they get they collect the sample from your nose. They
Okay,
just swipe your
like a
nose.
swap. Mhm.
Yeah, and that can be a little uncomfortable, I know. Yeah, but they do that, and they collect it in the sample container. And I mean, that is kind of excellent. It follows all of the protocols that regarding quality assurance for that. As I said, I'm very observant where the sample is placed, where it's put. I look at it and say, okay, yeah, things are going on the right way here. But and after that, the unfortunate thing is that everyone is, once you've done your test, you leave in the airport. So if you are positive, you will know from your result. According to them, they will contact you, and the tracing and all that. So the fact that I didn't get contacted, I my result was negative anyway. So when I entered Liberia, I checked my result after I think 3 or 4 days. But there are some people who complain about their results are not giving ready. There are a lot of complications and in analyzing our specimen, I'm sure. So, but for me, I did see my result. I was negative when I entered. But prior to going to Liberia 3 days before, I did a test was negative. So when I got in Liberia, I did a test. I was negative.
So how
But
long
then,
did it take before you get your result? So you get to the airport,
yeah.
they get the sample from you. Where do you get your result before leaving, or is after?
No, it's the it takes 2 to 3 days to get your result. It's not a rapid test. It's the
Okay, so within the 2 to 3 days, where are you? You go by
I'm
your
in the
married wife.
population. Yeah, I'm in
Okay.
the population. So even if I'm positive, I'll be infecting other people probably.
Ladies and gentlemen, if you are just joining us, this is Focus on Liberia. My guest, Dr. Saki Golafale. He has just returned from Liberia. He's down with COVID. He's now recovering, and he's sharing his experience. Dr. Golafale is an adjunct professor of chemistry right here in the U.S. at a university. And he spent a lot of time in the chemistry lab in Liberia and even here. So he's very much familiar, and that's why we are talking to him to get his experience. Also, we have Abby Tyler, who's a family nurse practitioner right here in the United States. And we're having this conversation. So, Abby, I don't know how testing work here from in your experience or at other airport, you may not be there, but the purpose of the test is to make sure that you are negative or positive, right? So if we are taking the test, whether you are negative or positive, there's no rapid test, so we're not going to know. So you get in the population. What's the point of taking the test? Is just to know later, or what? Is it preventative, or what is it?
It's more. I mean, you to know is based this on the need to know basis, and you have to get a test. Even if you when you do the test, you come into what should be the protocol is you get tested at the airport. The main thing is to make sure that if you are positive, that you're not intermingling with the whole population. So when you do take the test, and for some people that go to Liberia for a short period of time, so they may not want to waste those 2 to 3 days just sitting home waiting. But the best thing when they get tested would be to say, okay, as much as possible, try to limit the amount of interactions you're going to have while you're there. So at least that way, when we have the results and all that, and if we call you with the results, and we can say, okay, this is what we found. You can quarantine for this amount of period. But it's kind of difficult. Like I said, people going back home, you have a limited amount of time to be there. So, and there's nobody's going to be looking at you, trying to figure out whether you're leaving the house anyway. Even over here, nobody's monitoring your whereabouts. So that's what is the honor system comes in, where it's like, I'm trusting you that when we told you your test results positive, that you're not going to go out there and just infect people. What a deliberately, nobody's doing it deliberately, but you have to move about. So do your best as possible to try to limit the amount of people you're interacting with until your test results come back. And then when they do come back, and if it's positive, these are the things that you need to do to keep other people safe in the house and around you. So,
Dr. Golafale, I hope you were told that, like, hey, you're going to get your result in 2 to 3 days, but make sure you observe XYZ protocol. Isolate yourself until you can know. What does the process look like there? And did you hear back, or you have to call to make sure that your result is negative or positive?
No, what they do is that they give you a unique identification number, and that number is what you're going to use. I mean, as I said previously, the data management process, what I observe is a unique one where you can track your number, your data, and everything about you based on the identification number. Because I even praised the team that were collecting the data very fast and effective. They put it in the app and give you a number. You have to keep that number. Now, when I get home after 2 or 3 days, I can check the website on the Liberia COVID, I think covidresult.org, something like that. And once you put your reference number and your case number, your result is going to come out.
So one question: how are people who, and this may be a little bit off the topic, those who have no access to the internet, or those who have no access to computers and things like that, like other places, when they get their test results, when they get tested, how do they find out their information? How do they make those people aware of information? Or do they want to find out in a timely manner? How do they get their information?
Well, what I was made to understand that when you provide your contact number, your Liberia contact number, they're going to send you a text message and to download your result or something like that. Or they have your email, so they have all
like emails, internet. So
email, internet, but they have your phone number, and some people I saw do receive text. Some people do not receive text, so it's kind of a little bit challenging, I know. But everyone who has access to our contact number, they are told that, particularly me, I was told that I'm going to receive a text, or I should use my number to check the internet for my result, so it's both ways.
Thank you. So now you're in the population. You're in Liberia for how long, and what did you see? What did you observe when it comes to the people, the COVID response, how people are treating this whole disease everywhere else? How long were you there, and walk us through your experience while in Liberia?
So I was in Liberia, thank you. I was in Liberia for 3 weeks, exactly 3 weeks. And it's still, people are just kind of relaxed. It starts from the airport, the entry point. people are very relaxed about COVID, and when you get among the local population, you see that, and I'm guilty too of being relaxed about taking the necessary precaution of wearing masks, and it's culturally. I mean, I felt at some point when I was wearing masks among everyone who didn't have masks, I felt like I was out of out of place. But I wore masks at some point, and some point I didn't wear masks. But generally, when I arrived in Liberia, many people were not wearing masks, even at public places where you have on the billboard, I mean the signboard, no mask, no entry. It's just a writing, and it's just a warning that nobody respects. So I have my mask when I see on a public building, no mask, no entry, I will wear it. But I'm seeing people without masks, they just by their normal business. So I had the feeling that people felt one, COVID isn't that severe in Liberia, so they had to be relaxed. Two, there were people who still have this misconception about the signs of COVID, and they say all kinds of things about the different conspiracy theories and all that. So there's this vaccine hesitancy. People have huge doubt, and I just want to use this medium. We have to emphasize that people need to take the vaccine. I took the vaccine, and we'll talk about my COVID positive thing later. But it's important to take the vaccine to reduce the severity so that you don't get hospitalized, especially for people who have unknown pre-existing conditions. I say unknown because Liberia is a case of a lot of people have unknown pre-existing conditions. I would say that I think the medical person will want to expand on that more, because a lot of people do not do their annual checkups to know their ongoing medical conditions that they may have. And when COVID kick in, it becomes a serious problem. But generally, people were relaxed for the 2 weeks, first 2 weeks in Texas and all that, until there was a new release from the National Public Health Institute on COVID protocols, and the new cases that were the rise in the number of cases, and restrictions on number of people in Texas were only done 2 weeks. After 2 weeks I was there, but all along people were like 4 in the back, sometimes 2 in the front, no mask, crowded red light, crowded markets, no all the buildings I saw with signs that no mask, no entry, nobody respected that. But at the banks, at some point, some private entities, especially at the banks, you have to wear your mask before you enter. I remember I went to the bank, I went to a pharmacy, you have to wear a mask. But for the public buildings, it's something that was not well addressed by the authority.
So I just want to regroup. You were negative prior to going to Liberia. You were negative 2 days after entering Liberia. There were times where you were relaxed on the mask issue back and forth, and then you came back to America, and then you were positive?
Yes.
So part of that was your fault?
Yes, I say I'm guilty about relaxing
And I'm not just thinking, and it's not a thing onto you, because I did write a post on my page about a month ago, or even 2 months ago, when I saw a lot of people. That's when a lot of people were going back home to Liberia for a visit, back and forth. And they had me. The good thing about it, I was happy the fact that local businesses were getting the money needed for the tourism part. But everybody I saw who I consider to be educated, not considered to be educated, they are educated, and they know everything that we went through in America when we had the real first wave and real second wave. And it went back home, and it's almost as if they got to the airport and it was like, okay, there's no COVID in Liberia, and we can just do as we. And I'm not lying, because they posted all these pictures.
Yeah,
they were in crowded places or in businesses and all that. And it was like, well, this person wearing a mask. Sometimes I saw them wearing a mask and they didn't, was down here. I'm like, you live in America, you know these things. So
right.
I after a point I started saying, well, maybe there's not there. Maybe there's something. Liberians would be lucky around this time, but as a health professional, the public can relax their guard, but the public officials and all the health professionals cannot do that. They should be preparing for all. So, but So it's like, you went back home and you didn't want to wear a mask, and then you come back to America, you wear a mask. So if you get infected over there, and I know most of the people who are living over here, if they get sick, the first thing they're going to do is jump back on the plane and come back. And as much as they prove to be like, oh yeah, we're, my country, my homeland, they won't want to be in a hospital in Liberia. They will jump on the plane very soon and come back.
Yeah,
So
I follow Saki most of the time. Saw him drinking coconut water, and I didn't see him. So Dr. Saki, you also visited, hospitals, other areas. I know, or I follow you when you were there. You went to the university. What did you see if you visited a hospital, if you saw maybe much wherever you went? What exactly did you see? And then with the university in your chemistry lab and all around, you were there. Did you even visit any of the testing centers where they collect samples and all these things?
Yeah, you see, I don't want to speak about the hospitals. I will talk something later about, the number of reports I was getting about people who died of COVID, and what their last treatment was, especially when it comes to the issue of oxygen. We'll address that later. I made a post on that, which I wanted to have a conversation on. But yes, I visited a lot of places, and some quietly. I visited places and just observed what was going on. And I want to speak to the testing area. When I got to know where, because you had to do your test 72 hours before leaving. Okay, so it's I'm not sure if they have increased the number of testing areas in Monrovia, but they have only one site around Sophie where and when I went there, I observed the place the same way you enter the airport. What you observe is what I saw on the outside. There is no social distancing outside. People are just crowding up, and yes, they'll collect your information again. The same process. You pay, and then you're gonna go stand on the line. But some of the things, when you raise these concerns, people are come at you and feel that it's something that has political attachment. It's not about politics and this conversation I'm having here, but it is about ensuring quality. I have a background in quality control, quality management, and things like that. So when I see, something that borders around public health, like collecting sample collection and handling, when you read the quality assurance guidelines for institutions like CDC or the African Centers for Disease Control, they have prescribed quality guidelines, quality assurance guidelines that falls within every country's public health quality management system. You have three components of that: the quality control. Under the quality assurance, you have three components: the quality control, the external quality assessment, and you have quality improvement, all that. In one area, I saw that there's a need for quality improvement is in the area of sample handling. I'm sure the nurse, Ms. Tyler, are going to speak to that. What I observed that I'm sure a lot of that is going on is how samples are handled. COVID is, when you look at the biosafety level, COVID 1, 2, 3, and 4, handling samples fall on biosafety level 3. And that is, it has to be handled in line with prescribed protocol by either it's WHO or the country-specific quality assurance program. But what I did see, I'm going to talk about that right here, is we stood on the line before entering a building for our samples to be collected. And I watched, as I say, I'm very observant. I watch. Also, outside is a chaos where people are just clustered together, no social distancing. But when you enter, they have chairs lined up that are distant from each other. That is good. But the sample handling that I observed that scared me was when you have a specimen that it's of biosafety level 3 for infectious, disease sample collection. You don't take it and pass it among people. I saw that with my own eye that samples were sealed in a Ziploc bag, a clear bag, and someone walks outside with gloves on their hand, pass among us, and I'm just watching and say, where are they taking this? And then the lady walks to the unfinished building right by. There's a man parked there with motorbike, and they have this bag. I assume it was to put the sample in. But to my utmost surprise, the sample specimen bag was placed on the ground, the bag open. And when you observe all that, as someone who has worked in quality labs, and things, you look at, you say, okay, everything there is compromised. Yes, someone may go and say, argue that, I can go analyze a sample and I will still get the result I said, but it's just rare for someone to see someone walking among people with something that has written on the biohazard. Those things, we shouldn't see them. They should all be seen. In my training, Ms. Tyler, you can come in on that. But that was why one observation I made, that I said, this environment isn't safe. One, there are a lot of breach of quality protocols in here that I've seen. There are some of them I won't say, but there's a lot that needs to be put in place in terms of assuring confidence in the results that come out from the laboratory tests and all that. And from sample collection, that is the pre-analytical stage, the analytical and post-analytical. I don't want to talk about analytical because I don't know what to do there, but the pre-analytical stage where they're collecting sample and handling, from that one instance, what I observed, I think a lot is going on like that, and it actually compromises the integrity of the sample collection and handling process.
So you see the collection, because they put it on the floor and they pass among the people with the sample, and you could see that's what's wrong?
Yeah, it's wrong. It's wrong. It's wrong.
They should take measures not to do that. And it goes back to the point, do they know that is wrong, or not that they don't care, or it's just that they don't have enough, personnel or other thing to say, let's not do it that way, or we just doing it the only way we know how, we're doing it the best way we know how because this is what we have. So
yeah,
I mean, that could be, and I'm not talking about politics, but as talking about guidelines, I know you're talking about World Health Organization, Centers for Disease Control, all those things, and the guidelines, they're all followed by people who make laws, and people who make laws are politicians. So that's not good there, though. But.
So, Dr. Saki, what do you think was wrong? According to Abby, did they don't know, or don't care, or do you see the guidelines as to how this needs to be handled? What do you think the problem was?
The problem was the handling. Handling.
Why they handle it that way?
I don't know. I think there's an issue of. There's a problem with consistency in our setting when it comes to upholding quality protocols. You can start with it and people, forget. I mean, I've worked in labs where people do breach quality protocols, but the important thing is when these things are observed, when you have people watching, they can take actions. So if someone who is the manager at the sample collection site have observed a lot of shortcomings, especially with sample handling that are observed. If that is something they have all observed, then they need to put in what we call corrective actions. Document that in line with the quality protocol, they can take corrective action. If there's a need for additional training, which I think there's a need, they should understand that they have to uphold biosafety level 3 according to WHO, CDC, all of the standards that are available for different organizations around the world.
Okay. So now you're in Liberia. I think you were in Liberia where there was this surge. People were dying, some we don't know. Some were speculating that it could be the COVID or the Delta variant. And most people who are dying, we see you talk about the oxygen tanks. What did you hear concerning those that were dying possibly from COVID?
Well, good question. I asked a lot about deaths because I experienced 4 deaths in my family when I was there, and a lot of them were COVID related. Uh, and I also reached out to friends who had relatives died, and they were all tell you, oh, some dead bodies were not tested, or some were tested and they say COVID, and so on and on. I've been hearing a lot of COVID related deaths, and one of my questions I've always asked is, what was the last treatment administered? And oh, the person was on oxygen, and so the continuous hearing about people on oxygen, and all of these people I've talked with and friends and families that the person was on oxygen, or it's COVID related there. So I kind of ask myself question as a scientist, uh, you don't sit and just get information like that and don't ask a lot of questions. I ask myself questions. What is the cause? Is it because of COVID? Is it because of the severity of their cases? And is it the quality of the oxygen? What is it really happening? And unfortunately, we don't have uh, rolling data on our case management, and all that. We don't have publications coming on regularly for us to read about how the cases have been managed and all that. So you have to ask, you have to rely on other people, ask them. Some people don't know. They say, oh, the hospitals, they do gather data. I know some people do come up with very important research about case management in Liberia. I follow that. But what I'm saying is that as a scientist, I ask myself several questions. Is it the oxygen? Now, if you want to solve a problem, you will like that of why answer the question of why people are dying after oxygen therapy, and their deaths are COVID related. Now, I ask myself a question. I know Liberia has been challenged over the years with regard to oxygen. Right now, uh, SIM, ERWA, they are saying they are oxygen acting for donation for people to help with oxygen. So I know that according to oxygen is a drug. It's an essential medicine according to WHO.
Mm.
It has to be prescribed according to FDA, where it's a prescription drug. That is medical oxygen, not just any oxygen. Medical oxygen is a prescription drug according to FDA, and according to the WHO, is part of the essential medicines. So I'm sure that the Liberia Medical and Product Regulatory Authority should ensure that everyone who produces oxygen should be of high quality. So my question was, is it the oxygen, or is it that people are severely sick? Or so I asked a question on Facebook about that. What type of oxygen is being administered to patients, COVID-related patients? I mean, it was kind of naive to ask some questions, but you have to ask it. Is it medical or industrial grade? Because there's a difference between industrial grade oxygen and medical grade oxygen. People need to be educated. Public health information need to go out there about the quality of drugs being administered, especially when people are giving oxygen, medical oxygen. So in medical oxygen, just by the name, doesn't qualify it to be doesn't qualify it to just give to people. It has to go through quality test. What the percentage of oxygen, at least 95.5, 99.5% purity. That should be a medical grade oxygen. So are there data on the oxygen quality that's being administered to people? Are the regulatory bodies monitoring these things? What's the moisture level in the oxygen that's being given to people? All these things are important to inform public on, to have some confidence in what when oxygen therapy is administered. So I'm still doing my search to know,
what that is.
yeah, in terms of the quality. I can make a conclusion right now.
Right.
Still yet a hypothesis that, okay, I think the quality of oxygen is poor. That's my hypothesis. I'm not concluding on that. It can be tested by someone giving me information. But recently I learned that there was an oxygen plant donated by the Rotary Club Rotary International and Rotary Monrovia to ELWA. But even at that, considering that oxygen, medical oxygen is a drug, it's a prescribed medication according to WHO, it has to meet the standard set. It has to meet up with the purity and all that. So we need information on that to know, have confidence in when people are giving oxygen therapy.
Thank you. And before I come to you, Abby,
okay.
People are donating oxygen. Thank God, we have people, making donations. And again, to your question, those tanks or this oxygen being approved, who determines what they are, or are we just lucky and happy to receive anything? So let me come to you, Abby, and you can add to what you were going to say as to what really this oxygen is. Saki talked about the industrial and the medical oxygen. What's your own experience with oxygen here in the U.S.?
Well, anything that's been donated to the hospital as far as medication or oxygen, which is also prescription as well, that should be okay, or it should be clear through the infectious disease department, the quality assurance department, and all that. So any questions about it should be on the data somewhere where anybody can go to a hospital or somebody who's doing any kind of research to follow through and say, is this what the kind of quality of oxygen you're getting? And also, I mean, or the pulse ox, the little device that we put in the finger to see the oxygen level of the person, are they getting the amount of oxygen they should be getting? So it's not just the quality of oxygen, are they getting the amount? Because sometimes you see the nasal cannula, there's a two little prong that goes into the nose. Okay, but when the patient's level is, the oxygen level is so much lower than normal, supposed to be like 92 to 100, usually it will be 96 to 100. And if they're like 80, 65 to where they start experiencing confusion and all that. So you can't go with just a nasal cannula. You need to go with non-rebreather. You need to go with Ventimax. There's so many different methods of administering medication, oxygen. So if they're not doing all of that, so it's not just and if you can donate like 10 tanks today, if somebody who's really bad off, if they need that, if they need continuous that, they need high flow, that could be over with in no time. And I was watching this. Somebody sent me the 30-minute clip. Nice thing with the COVID place where they're doing the taking COVID people, I guess outside of the hospital, I'm not sure, but like another annex part of the hospital where they're saying they have the tanks and then the oxygen, the respiratory therapist, he kept saying O2 therapist, so I don't know, he was saying respiratory therapist, and the nurses, they have to watch when they hook the people on the different oxygen tank. They got to keep looking to make sure that the tank doesn't run out, because if the tank runs out and the person really needs oxygen before that nurse or respiratory therapist can come back, that person could die. And I'm sitting there going, wow, so that means the oxygen is not, it's not connected to the walls, because if you're in a tank, it's a physical tank that's there. So God forbid, when we used to sit there and be in the hospital and we're gowned up, you got your mask, you got your everything covered up, you were one patient. By the time you get done with that patient, especially depending on the acuity level of that patient, meaning how sick that person is and all the things that you have to do with that patient. If I have to sit there and worry about, let me hurry up and go back to that room to make sure that tank is still full, chances are a lot of people are going to die in between there or suffer greatly, irreparable damage, because I didn't have enough time to leave from this person and go to this person. So that should be on the wall where it's running at all times, and is, you have the engineering department. Most of these hospitals, they have the engineering department. Are they, they should be readily available at all times, and doing that. And when I was on the quality control committee in my hospital, when we met every month, we also, and then we had the environmental services, we had engineering department, we had dietary, we had everybody there. So everybody's sitting there. And then when during COVID time, people they were meeting even faster. They were meeting more frequently, because every day I was like, what are we doing? What are we doing? We're going to do in a huddle today. What are we doing? What do you need? What do you need? What do you need to have the hospital functioning appropriately? So if that is not there from the top and coming down and coming down and coming down, so by the time you get there, you're asking questions to people who like, no, I'm putting this oxygen, this person knows. As a nurse or as a respiratory therapist, I'm comfortable in the fact that those who have the ability and those who have the knowledge to know what was donated to us have already checked all of that before it comes down to where I'm doing, and I'm first in the last line of defense for this patient. So if all those other factors are not there or not regulated, then just asking the questions, what kind of oxygen you're doing? Nah, I wouldn't know. You go ask the people who will handle these things, because I'm here taking care of the patient.
So Abby, what's the difference? You talk about oxygen on the wall and the oxygen, the portable one. What's the difference? How will you know if you're in the hospital that this person's oxygen is low or is finished, so let me go get it, or let me give some more.
Usually the little tank that we have is usually the tanks that we just put in the back of the wheelchair. If the patient's leaving the floor to go to like another department, let's say the patient's leaving the floor,
Right.
mainly if they're not too sick with COVID, we don't move patients around too much. If they're going down for a test, let's say I have to go for a CAT scan, I have to go there. They put a little portable tank on the, we have little portable tanks that we put in the wheelchair, and the transporters take the patient. So we know that we can see the gauge, how much their oxygen tank, how much it is. And before they even take the patient off to the test, they already know how much it's going to be, and if they need, they can just put it there. But the ones that are in the room that are connected, it's always running. So all we have to do is just turn it up. We take the different, like I said, different methods of administering oxygen. It's already there. All we have to do, all we're doing is just measuring the gauge. The most important thing is every time you go into the patient's room is to make sure that because when you are assessing the patient's room, you're not only assessing the patient, you're assessing the entire room. So you're making sure that the tubing is not under the chair. This one is not being pulled somewhere. Everything. So you're doing that. Like every time you see the nurse or somebody walks in your room, they're assessing the entire room. That's all part of our purposeful rounding. We do that purposeful rounding. You're looking at everything, safety measures, and the patient as well. So that should be there. And then when you turn it off, you turn it off. So you're not running out of oxygen when you're sitting there hooked up when you really need to be there. Because our COVID patients, when we went in the room every time. When we started doing it, it's like, okay, don't go in the room, do what you have to do, and get out. You can't be in that room for too long. So imagine, like, if I'm not seeing you again for another 30 minutes and your oxygen runs out because you're hooked up to a portable tank, God forbid, And also, are these people getting the COVID medicines that they're supposed to be getting? It's not just the oxygen that's going to save you if you have COVID. Are they getting the IV medications they're supposed to be getting? So there's the whole protocol that you have to follow. Yeah, it's not just oxygen, but oxygen is like one of the main part, because like I always tell people, if you can't breathe, nothing else matters. So if it's not done the way it should be done, and I'll say, and I don't want to be like at the point here, but like one of my friends always saying, everything that needs to be done in Liberia has been done somewhere else. So all you have to do is just take all of that, all the blueprint of everything, and take it and then just tailor it to where it's not going to be perfect, because they don't have everything that we have, and take it the best that you can. But people just sit there, put their hands up, and be like, oh my God, we don't know. Oh my God, pull Liberia, pray for us, pray for us. You have the knowledge to do it. Do it.
When someone listening to you now, they say, oh, she's in America, she doesn't know Liberia is a different animal. And Saki, you were there, So Abby, so now the thing is, that's America. This place is not America, so you don't expect things to function the way they function at the Children's Hospital of Philadelphia, or Mass General in Massachusetts, or Emory Hospital in Atlanta. So you guys, you don't have a clue what we are dealing with here. What's your answer to
that? Those who are trained, those who are doctors, and most of the people who work over there have background knowledge. They were educated over here, and many of them, not only that, many of them have lived in the Western world before. So it's not like they're not just people who just came out of school and just nothing and just became and started working there. They have lived over here, and it's how hard it is to do that when you can just get on the computer and just go and you can go to your conference on the computer and we do our continuing education on the computer right there. All of JFK, all of them can just sit there and be like, okay, at this time, they're going to be doing this conference on this. Put it on the computer. Everybody, like I said, the head of all the different departments. You watch it and see what they're doing there. Okay, we don't have all this equipment. We don't have all of this. Let's do the best that we can, following their guidelines, following all of this, and try to save as many people as possible. This is not something where they have no way of having this knowledge. They've been here before, and that's the reason why most of these people who live over there, in government officials, their family members are over here, because they know over here they will get the best of care and best access to healthcare, and then over there. And to further my point, you cannot run this healthcare system based on crisis every time. So in between crises, that's when you want to make sure that, okay, I'm getting this equipment, I'm getting this every year. Okay, we're going to dedicate the next 6 months of buying this or buying that. So when things like this happen, you're not running around trying to figure things out, because it's already there. Yes, COVID is new. We were all suffering over here because equipment that we had or supplies that we had that used to last 1 month were going in a day, and hospitals were really suffering on that. So when you have that opportunity, you had a whole year to see what could go wrong. You want to tell me they couldn't get all those things in place?
Thank you. And Saki, we're going to get to your story now, coming back, but we'll take a short break. And there are comments here. Abby, you have questions here for you, and Saki also question, because there's this whole thing about politics, right? So it means, for instance, and let me say strictly, Judge Weah is in power. So when you talk about COVID, it means you're talking against Judge Weah. Well, Ellen Sirleaf is in power. So when you talk about the poor handling or how Ebola is being handled, it means you are talking politics, you are talking against Ellen Sirleaf. Please, for today, let's talk COVID, and we are talking COVID, and we are doing something to help the people. So let us all work together. But we have questions here, and Saki, prepare for the questions on you coming back now. You left well, you were tested before going. Now you went to all the places, you drank all the coconut water, you are now wearing masks in other places, coming back with COVID. And so we'll talk all that, but let's take a short break, and we're going to be right back.
Ladies and gentlemen, parents and guardians, here comes the biggest opportunity to send your kids to school. The Vision School System, located in PHU Zone Community, presents tuition-free school for a semester. A Vision School System, commonly known as Vision Academy, the entrance fees is just $350 Liberian, while registration fees are in different categories. Registration commences on July of this year and school kicks off September 2021. At Vision School System, commonly known as Vision Academy, you can pick up your entrance package for just $2,000 Liberian for nursery and $2,000 Liberian for K1 to K2. For first grade to grade 6, it's just $2,500 Liberian. The CEO for Vision School System, Dr. Emmanuel Dekie, sees this as a way of giving back to society. Don't miss this great opportunity. Vision School System, commonly known as Vision Academy, is located in PHU Zone Community. Take this opportunity serious and run there now. When you get there, tell them that Abigail Media and Consultant Incorporated sent you.
Welcome back to Focus on Liberia. We are discussing Dr. Saki's Golafale experience with COVID in Liberia. He was in Liberia and he's back, and he's sharing his experience. I have family nurse practitioner Abigail Tyler. She's a health analyst here at Focus on Liberia. Dr. Golafale, let's look at some questions before some comments from our viewers, even before we go ahead. The first one here is from Jerome Gaiman. He's a co-host here on Point. He said, I see no logic in this. I just traveled from Orlando to Boston 2 weeks ago. We were packed in the train to transport us to the terminals. No, we were packed like sardines. Orlando gets 134 million visitors a year. Even as we were awaiting the train to transport us to the terminals, when the train came, it was basically everyone for himself. These things are almost impossible to monitor and enforce. Why are you all behaving as though Liberia is unique? You guys should be ashamed of yourself. Saki, are you ashamed?
I'm ashamed that I got COVID. That's by, not taking the precaution. That's the only thing I'm ashamed about. But I think what Mr. Gilman is missing is when you have a testing protocol in place for COVID, it's different from you traveling from airport to airport, or getting packed in like sardines. I mean, your safety is your responsibility. But when a government health system sets up testing protocols for COVID, they have to put everything in place to ensure public safety for the staff, their workers, and that of people who are coming in the country. So I'm simply speaking about the airport. The room is small to host everyone. It's jam-packed. And in the USA, I'm sure Mr. Gayman has not gone to do a test anywhere where they are packed like sardines, in the test hall before doing their COVID test. So he needs to understand there's a difference between traveling between airports where you people gather in the train or whatever, and when you have a test center, that you follow strict for public health protocols,
Thank you.
ensure people are safe.
Thank you. Abby, you have a couple of questions here. So for your 2 minutes,
Can I speak to what Mr. Gaiman said?
let me bring your, okay, go ahead, 1 minute.
See, Mr. Gaiman, his credentials, isn't he like a high ranking member or surrogate of the CDC?
He's an unabashed, unapologetic seditious, but let's speak to his point. Let's forget about who he is.
No, that when you say don't bring politics into it, this is some of the things I'm talking about. You can't come as a surrogate and, then you say in there and then you come and say we should be ashamed of ourselves. Why would I be ashamed of myself? Why would I be ashamed of speaking about healthcare, something that I'm trained to do? And when from everything the doctor's saying, and I'm just speaking on what I'm trained to do, my education. That's the thing about Liberia's healthcare. Anything that has to move Liberia forward. The minute you start saying anything and you're not singing the same tune as the people who are in power, then all of a sudden you should be ashamed of yourself. You're talking down to Liberia. You're doing this. You're doing that. I mean, I would love to, but thank you, Mr. Gamer. Your comment has been received.
All right. But yeah, a few questions.
In addition, I would love for Mr. Gaiman to come on the show and let's talk the issues, not the sentiments about, saying we should be ashamed of ourselves. Let's come and talk the real issues about the issue of quality in the healthcare, what I experienced. If he has an idea on how better it can be improved, which we are talking about here, it'll be welcoming for him to come on the show.
All right, Abby, you have a few questions here from Mianta Stella Herring. So I'm going to put a couple of them on. The first one is exactly what is Abby's recommendation? Question number 2, how will Abby know that the people in Liberia, the doctors and people that live in America all are from here? Number 3, how can Abby contribute to this thing? Has she offered to volunteer and go to Liberia and teach the people since she is so knowledgeable and experienced? Question number 4, can she do a podcast at least once a week to train nurses in Liberia? Abby, you want more questions? Okay, let me stop.
No. What was the first question? Well, I already gave my recommendation as far as when you're testing people that at least, just suspend the trivial, for that formality and just go ahead and say, okay, how you doing? And get your test results, get your test done, keep it moving. So at least not to expose too many people in one place. That would be one safety aspect. I'm also of the knowledge that yes, Liberia doesn't have all the equipment and the personnel and trained personnel like we do. But at the same time, you cannot sit there and just take mediocrity and just hold it so close to your heart. You still have to follow guidelines to first and foremost to protect yourself as a health professional, and then protect the public. Because if you're not safe, the public won't be safe. When we were working in the hospital, when I worked in the hospital, they did the best so we don't get sick. Because when the personnel's down, when the patients are coming, after a while, they will have to defer those patients to other hospitals because you don't have the personnel to take care of all these sick people. So you want to protect yourself, and you also want to protect yourself when you go home to your family. So when you follow the protocols, yes, and how do I know if people lived here before? Well, I know now that one of the person who worked at JFK used to live here before. She's a trained American, I think NP or nurse. And most of these people have come back and forth to America. You have access to any kind of thing, anything that you want to know about in Liberia. You can go to the CDC website as a trained medical professional. You can go to the CDC website from Liberia. You can speak to somebody in one of those agencies from America and get that information. People come here for training all the time for continuing education. So they're not living in a village somewhere where they have no access to it as a health professional. Can I do a podcast? I have a forum called Abby Tyler Healthy Living. I talk about different things and all that, but that doesn't get any traction because I'm not talking about politics or woman man business, So, and if I'm so trained, I'm so experienced, that's a little biting because people always like, oh yeah, you think you know it all. They never say that to a man though. They never do say that to a man or somebody who with a doctor behind their name. I'm not standing here and acting like I'm so experienced and so knowledgeable. If that was a compliment, I take it as a compliment. I don't take it as a compliment because it comes backhanded. It's like a backhanded compliment. because, I'm the kind of person that, I sit there. I love teaching. I trained a lot of nurses over my 22 years that I work in a hospital. I trained a lot of nurses, and I've always trained, and part of my job as an NP, also part of my job as a nurse, we teach our patients every day. We have to document what we're teaching our patients every day, because we're not saying you do this and you go home and just do whatever you want to do. We have to train that. But we get malpractice stuff, they have to say, did you tell the patient not to do this, this, and this? And that has to be documented. So we do that. But I'm not, at the same time, a lot of people over there getting paid to do that. I can volunteer up so far. I tell people I can volunteer up to a certain point, then I have to get paid for my services. Just like everybody else is getting paid for their services, I have to get paid for my services.
Thank you, Abby, and I agree. That was not a compliment, because when a librarian person says, if you think you are so experienced, so accurate, but we thank you. We want to keep the comments coming, and Cornelius Hunter say, thanks, Dr. Golafale, for laying the issues out. Cornelius also said, Abigail, thanks so much for your time and insight to the real health issue. Dr. Golafale, you were in Liberia. You came back at the airport. You were tested again. What happened from there?
Yeah, so as per the public health protocol for travelers, and it's clearly defined on the National Institute of Health website and that of Ministry of Health on getting tested 72 hours prior to your travel, and I did my test. But it's a little bit nerve-wracking when you do your test and you're waiting for that test result before you confirm your travel. All right, two things: you're either positive or you're negative. And unfortunately, if you are positive, you have to rearrange your flight and stay 7 days, and you have to do your test again before you come. But fortunately for me, my test result was negative, and I got my test result 12 hours to my flight. So imagine, on the day of my travel, I still could not, determine if I was traveling until I got my test result. So that is one thing. And I, of course, following all of the safety guidelines, I traveled from Liberia to Belgium and then Washington and came here. And then after 2 days, I started feeling unusually sick, and not severe, but some unusual symptoms I start to feel. So I just thought that because of the trip, I was tired, and the tiredness and fatigue. So I had to go and do my test, and it came out positive, unfortunately. And I've been, in isolation as per the public health guidelines, received calls from my doctors from the Georgia Department of Public Health. And it was the Georgia Department of Public Health even sparked my interest in doing contact tracing, which I'm sure you may want to ask about.
Yeah.
So, yeah,
and we'll get to that contact tracing. I'm very much, in fact, the reason for this show is based on what Dr. Golafale did after he realized that he was COVID positive, and we'll talk in detail about that. But Abby, Dr. Golafale took the vaccine. He was fully vaccinated before going to Liberia. Now he came back, tested again. He's positive. What's wrong?
You can, like I said before, you can still get the vaccine. You can still get the virus. You still become infected after you've received the virus. Like I said, we told you before, nothing is 100% exact. And also the manufacturers, the medication, they tell you that yes, the vaccine is to protect you from getting as sick and then send you into the hospital. So your symptoms may get milder. It's not to protect you completely from getting the vaccine. It's to protect you from getting sicker as if you didn't get the vaccine before, and then less of chance of you getting complications and dying from it. That's what the vaccine does. It's like saying, I'm going to wear my seatbelt when I get in the car. Yes, the seatbelt will protect you, but that doesn't mean that if you get in a massive accident, the seatbelt is going to protect you for any eventualities. So it's nearly, but like you're putting like a little guard on, saying, this is what I'm going to do. But if I didn't have that guard over me, yes, and I'm 100% exposed to getting completely sick and having complications from it.
My next question is, he took the test in Liberia, he was negative. Now he came back. Someone may say, they're not doing real tests over there.
No, because it's also possible that, like I said, the viral load, meaning that you're not as sick to where if you took the test, let's say 48 or 72 hours, he probably started when it really started populating his body. He didn't have enough for it to be determined on the test when he took it in Liberia. When it came to America and all that, he started getting sicker. That's when it started replicating to his body to where when he went to get tested, that's when it showed up on the test. Because we've had patients before that came into the hospital that were negative in the emergency room, because what we did, everybody was in the emergency room, you got tested. If you were positive, you went to the positive floor. And we had people who were negative from the emergency room and came onto the floor. And then when they started exhibiting symptoms after that, we took to give them another test, and it turned out they were positive, and we had to move them to the positive floor. So that's depending on where you are in the disease of the illness after you got sick, and then it matured into your body. So when you get tested, it's possible that, like I said, you can get tested too soon, that the viral load doesn't show up at that time.
Could it also be possible that he took Pfizer and then maybe the variant that he got in Liberia might have not been factored into that vaccination? Could it be a possibility?
Right now, the manufacturers are saying that it's covering every variant, even the Delta variant, but I don't know what other variant out there besides the Delta variant. So anything's possible when it comes to science. That's why we don't tell you this exact. But most of what I'm saying right now is the viral load may not have been heavy into his body that at the time. So when he got tested, it didn't show up as negative. I got tested when I was in July, was it April this year, when I was really sick and all that. My test was negative, but I had all the symptoms. So I made sure I stayed away from work until I was feeling a little better before I went back to work. So, even though my test was negative, even like I tell people, even though the test is negative, we still have the whole disclaimer underneath there. If you're still having symptoms, make sure, you do this, and this, and this to keep yourself and your family safe.
Thank you.
I think I was asymptomatic when I was in Liberia, or I think they have this, the public health people, they have pre-symptomatic, asymptomatic, and then symptoms and all that. So I'm sure I was in that period when I did my test in Liberia. So, and then 2 days after my arrival, I started to feel symptoms. So it happens. So I trust their work, the analysis they do, the result they show. We have to trust it, from Liberia, except, some other quality measures need to be put in place to restore confidence. But yeah,
before you move on, because sometimes there is this attitude that everything done in Liberia is bad or is below standard or they are not doing it correctly. That's what comes from people. You were there and you saw the testing, you saw how they took the sample. Even providers, doctors, Abby alluded to it. Some of them are trained here. We have some of the best doctors. So talk to me about what you observe. There are some people who just put anything like, bro, put it down. I want you to speak to that.
Look, in terms of the sample collection process, I think my experience is excellent. It's comparable to people taking samples here. The fellow who took my sample at the airport did it excellently. And then even more when I went to do my test for travel. And I saw the lady who took the sample was all zipped in her entire PPE, no contact, no conversation with me beside, lift your head, and she took it and was just doing her work. They have a very excellent team that does the sample collection. It's a little, painful, taking the sample in your nose, you gotta tear gotta come out, Yeah, but yeah, overall they're doing an excellent work with the sample collection. Just minor quality issues they need to fix, especially with handling, based on my observation.
But it's not so much. Let me add to that. It's not so much what people saying that everything done in Liberia is substandard or whatever. Even over here, we have continuing education all the time. There is a certain amount, the corporation that I worked for before, you have in hospital, in corporation, continuing education. Then you have the continuing education that is mandated by the state, because every time we're like, you have to go to mandatories, Then you have federal continuing education. Even as an MP, we also have, before I renew my license and before I recertify, I have to have these amount of numbers of hours before I can renew my license as an RN, as an NP, and also for my certification, the certifying board also. So it's not like, so you learn something today, doesn't mean, okay, you learned it today and that's it. You have to keep on learning. And with COVID thing, we did more continuing education. So if somebody says, oh, maybe we shouldn't do it that way because if you do it that way, you can expose people, or maybe we should do that. Okay, then the education department of the hospital you're working, or the institution that you're working with, say, okay, let's do it this way, let's formulate a plan, we're going to teach the staff, and we'll do that. And you do that over and over and over, because also you want to make sure that you do the best that you can so nobody can come back and sue you. Accountability. People will be like, okay, yeah, maybe I got this disease, or maybe I got this because you didn't do that, you didn't do that, you didn't do that. Show me your paperwork to say where you show me where you had continuing education, and you show your staff that you took the measures to minimize any kind of exposure or any of that. So we're going to be looking at that. So when your lawyer's looking at that, the ethics department is looking at that, we can say, yeah, there you go, look at that. We're not perfect over here. That's why continuing education is all about. So when we bring up things and say Liberia's not doing it this way, it's not like we're talking against Liberia. I know there are people who are watching who also have issues with me politically, who would say, or personally, because I come across as, never mind. But anyways, that's what it's all about. So if I went back to Liberia to go teach people, if I was doing a webinar on Facebook or whatever, I'm going to say, okay, these are the things you learned that in nursing school. Have you had any more continuing education since then? Have you done anything different there? When I got out of nursing school, there are many things I was doing that I didn't do year in, year out. We have done things differently over the 2 decades I was a nurse.
Okay.
So continuing education and quality assurance, those are not bad phrases. They're not. They come with a negative connotation, but that should stop. We should stop thinking that way.
Thank you. Even on my job, we do that. We have to, I don't work. I work kind of partly in healthcare. So we have to do these courses all the time because things are getting tighter and tighter. So you have to prove to someone who is checking on you that, yes, I did what I'm supposed to do. Even something has how they call this, sexual harassment training. You have to do that. And you have to show it. So I wonder people in Liberia are doing that. But Dr. Golafale, let's go back to your story.
Yeah, and let me just add to what Ms. Tyler just said about accountability. One of the reasons people feel challenged with these concerns that when they are raised up is a lot of people feel they're not accountable to others. So the issue of accountability is hugely part of the quality management and quality assurance thing. When you don't feel accountable and you're doing something that borders on public health, and you pretty much degrade quality. You can do anything you want to do, and you feel you're not accountable. Nobody can question you. So sometimes people feel that you shouldn't come up with some issues on social media to talk about. And the reason is we don't have any database to channel our issues to specific people, experts. We don't have, like here, if I need to talk to someone that regulate, someone who is trained, who is an expert in the smoke detector, I can call them right now. I can just go and call. I know who to talk to. I won't go on social media and ask. But in Liberia, it's a different thing. Who are the experts to talk to on issues that you observe? You have to come out and then publicly and talk about it. And people come and say, oh, it's unprofessional to raise the issue. Yes, it's happening. We have to talk about it. And everything that surrounds public health issues should not be hidden. We have to talk about it, and people have to be held accountable. I'm a member of the American Society for Quality. I've been into quality things for long. I read about it. I follow developments on quality. And being higher education area, quality assurance is a big thing that I get ongoing training every time and then to keep me in the continuing education process, as you rightly said. So it is not to look down on Liberia that they're not doing the right thing, but we have to ensure accountability, which is it falls within our quality management metrics.
Thank you. And that is very important for this show and other shows on COVID. I have invited the health minister over and over. We still don't get any result. Anytime you want to talk about anything in Liberia, it's just hard to get someone to talk to. And I'm saying that against the background of this comment. May I just tell her and say, I will throw a challenge to these two that they team up along with other professionals to assist the medical professionals. Nyata, if you can tell us how, because we have tried to do this program focus on Liberia, get people responsible so that they can share their knowledge. It is very difficult sometimes to get to people that are supposed to be doing something about Liberia. Even if you want to help, who do you contact? Where do you go? If you volunteer, we had Dr. Dukwajan here. He has volunteered to have a lab in Liberia to produce these test kits. He's not getting traction. Some may say he's political or people think he's oppositional, but it's very difficult. So if you have some of these ideas, please don't hesitate to let us know. We're going to find the people that can team up to get things done in Liberia. Liberia belongs to all of us, and we're doing our best to play our part.
And a lot of people don't want you to know they're doing the wrong thing in Liberia. A lot. Yeah. And that's a problem. So they don't want to speak. They don't want to collaborate with you. They always feel afraid that you're going to tell them the wrong. They're afraid to be told that way, which is bad.
Yeah. Dr. Golafale, again, ladies and gentlemen, this is focused on Liberia. My discussion with Dr. Golafale and Mrs. Abby Tyler, a family nurse practitioner, is about Dr. Golafale's experience with COVID-19 in Liberia. We're doing this so as to assist people, spread the knowledge, and also put ourselves in a position that what can we do? We want to help. Dr. Golafale, let's continue with your story. We are out of time, but I want us to really talk about what you did, what happened when you found out you were COVID-19 positive.
So yeah, the first thing, I had a call from the Georgia Department of Health, and of course they're going to send my information over, and they give me the questions they asked me are just everything that I did on my travel, where the plane I was in, the seat number, and the city I came through, and all that, just for contact tracing purpose. So I gave them all the information, and then it reached to me like, okay, I think I need to talk to people too and know how, I keep in contact with people in Liberia. I need to know they're feeling okay, and just tell them that, okay, I'm COVID positive. I hope you're okay, because we keep in contact. So I did that with my family, and you wouldn't imagine how I was able to, from friends and family, different angles of my own personal contact tracing, and I was able to. Someone revealed to me that they were feeling similar symptoms, like I did. So it shocked me. I said, okay, did I infect this person, or this person infected me? Because they were sick before me. And I did a little rough mapping of me, this person I came in contact with, this person had a lot of other contacts. So I contacted people who were immediate friends to that person in case they couldn't contact them. And then I just mapped out my own interaction with other people in my family. And then I was able to also observe that there was another group of people that were connected to me, that someone had died from COVID-related illness. And then there was a gathering for that person. And then someone from there, I got to know they also were feeling sick. So personally, I was able to track. I said, okay, I know there are 3 possibilities of where I may have gotten infected, either on the flight or in Liberia through this route that this tracing I did, or another tracing I did where I interacted with someone continuously in the first 2 weeks, and that person felt similar symptoms like I did. So I was able to conclude that there are 2 ways of this. Either I got infected from that person, or I got infected on the flight. So that was my own way of trying to make, and all other people who I got in contact with, I asked them how they're feeling. They said they're okay. I said, all right, I thank God you're okay, because we interacted. And I strongly believe that because I was asymptomatic at the time, I was not infectious until I came to the US and some symptoms started to show up. Probably according to the public health people, sometimes you are asymptomatic, you can also infect people. Sometimes you are asymptomatic, you don't infect people. So yeah, the key thing is individually you can do your own contact tracing and just check on people who you came in contact with, just to know they're feeling good, and tell them your be honest enough, tell them your result so that they too can be on the safeguard if they are feeling some symptoms before it turned out to be severe if they don't know. So that was what I did, and I think was helpful for a lot of people and also helpful for me.
How did it help other people and you?
Well, I think for the fact that one of the persons who shared with me that they experienced similar symptoms like me, I think it helped them to build their confidence in going to take their vaccine, because we talk about you have to go and take your vaccine and make sure you're safe. I took the vaccine and my symptoms were mild, and for you, you didn't take the vaccine, you had similar symptoms like me. It was most likely COVID, but go and take your vaccine. And that person has taken their vaccine. I think one shot. They're waiting for their family taking the vaccine. Also, he's encouraging them. And I spoke to another person I came in contact with. They're also going to take their vaccine. So the thing about taking the vaccine is the key goal that people, once I speak to people, they have the confidence, the assurance that, okay, yeah, I think I need to take the vaccine. It's serious. Yeah. So vaccine hesitancy needs that's something it's a challenge to us in Liberia. There are a lot of misconceptions, and we need to speak out about people taking the vaccine, that is safe. It has no like one of my friends were telling me, which was very logical. Like someone said that the people want to kill them in Liberia, and a friend of mine said, and if the people want to kill you, why they will go and spend billions of dollars to fix one ampule just to kind of put it in poor man like you, why they can use other means, because everything you use here is from these people. So, but it was funny, but it makes sense that we have to find ways to educate people and take them out of that mindset of the conspiracy theory about vaccine and all that. So yeah, it helped greatly to challenge people to go out and take the vaccine because of my experience, I think.
Well, go get tested. At least I'll go get tested.
Yeah, go get tested also. Yeah.
And
So Abby, let's talk about this whole concept of contact tracing, because when Dr. Golafale explained that, it really it blew my mind away. That first of all, there is this sometimes stigma. Almost every sickness in Africa, people don't want to share that. Oh, I got this, and so they won't want to tell people. Oh, I'm sick, and we met. Tell me about how this whole idea of contact tracing can save a lot of people, and can prepare. And we don't need money for this. I mean, I can say that. All the things that we think we need, we need money. But let me rephrase that, because most of the time when we have these issues, the first thing we want international support. We want this help. We want this help. We want this mission. But there are basic things that we can do today that may not require all that huge international support. Talk to me about contact tracing and its importance in combating this virus.
Well, I'm not in a public health department, but in my role, also when people call me to tell me, this is what I did and I want to come in and get tested, I always ask, who were you around? How long ago was it you were around those people? Did those people get tested? Have they started having symptoms? It would be best if you reach out to certain people and just say, well, at this place, and I was feeling bad, and I went and got tested at my doctor's office. You might want to go get tested too, to make sure that you're okay, and test people in your house. So most of the time, people call me. I usually ask those questions because you want to make sure that's again where the honor system comes in. I mean, as such the way he described, he didn't have to call any of those people. For the fear that people worry about is a stigma to where if you get infected, that means you didn't do this, you didn't do that. Some people get infected, whether they did everything right. So the honor system comes back in, this party, and just make sure, just go get tested, just to make sure, and call as many people as you possibly can that were at the party or at whatever event you were, that for them to go get tested. And they don't necessarily have to tell anybody about it, because some people, it's your own personal business. You want to keep it to yourself. But it would be kind of nice that if you're infected, to call people and say, yes, I was infected. And I always tell people too, those who call me and say they want to get tested, try to see if everybody in your household can get tested too, because you don't want to be the one get tested, doing isolation, and everybody else is still sick. So just everybody get tested at the same time and go on from there. So the public health department, they usually, when you come there, they tell you, okay, where were you? And they start calling people here and there. But sometimes also difficult too, because you can't get to everybody who was there. But pretty much, okay, a lot of people were at this event today. And I also tell people to, if you go into funerals, and don't, if you tell you this amount of people can be at a funeral, don't feel bad that you're not going to be at a funeral. Last year, I've witnessed about 3 to 4 relatives and friends funeral on online. I was sitting there watching. I wanted to be there. I wanted to be able to comfort people, but I couldn't be there. I always say one funeral shouldn't lead to more funerals. So, and as much as you can, limit the time exposure, especially now in Liberia when everything is going on. You're still going to the third wave. When they put out the mandate, don't do this, don't do this, don't do that. That's all for your own good. Because you don't live in a country that have the most up-to-date equipment and personnel and trained personnel. So you want to do as much as you can to keep yourself safe. Do the best that you can to keep yourself and your family safe.
Thank you. And we'll be winding this down. I want to thank you both for the time. We still have some comments here. I want to read a few of those comments because few comments. And Mirta came back saying she can assist when we talk about how can you help? We say, well, we can get those people. Say she can assist, and she's given Abby and other nurses ways that all of us can work together. Cornelius Hunter say, thanks. We need all the help now, and our people need to open up. Our people know what to do, but seem nervous and confused for some strange reasons. So we all can do that. John Conway, we have got a bunch of incompetent people in government. Oh, my man. Let's keep this thing COVID, except from the president down, so they have adopted this attitude. And Cornelia said, Mr. Dennis, I'm enjoying your show as your voice remind me of the late Francis Bleedy on his show Road to Hell. Okay, thank you.
So wait a second, Dennis. You read the other person that was pro-government. You read his entire statement and everything with emphasis. The other person, you're like, oh no.
Because he's insulting a bunch of incompetent people. That language, we don't want that language. Yes, you can say it. I do not believe, and I'm not here to censor the comment, but I don't believe that everybody in government is here to get us, right?
That goes back to the topic. Are they incompetent, or they're not aware of it, or they're just apathetic? That you have to add all that.
We don't know. What we know is the handling of COVID is not the best. It's very poor handling of COVID. And as I was saying, when I said some of these things, you don't even need all that much money. You don't need money, for people to social distance. You go to a place, we know that now it's COVID, people dying from COVID. You still haven't packed funerals. So there are a lot of things we can do. And in this case, we need leadership. President Weah should take his vaccine and show people that vaccine works, because there's a lot of vaccine hesitancy. People are saying, oh, well, they're going to kill us. Bill Gates is going to kill us. You want to tell me all the businesses lost money just to enrich Bill Gates alone? I don't believe that. But let's give our final comments before we sign up, which is, so with everything that we've expressed, what do we do? But before I ask you from your final comment, let's take this short break.
At Focus on Liberia, we discuss everything Liberia, from education to politics, arts and culture, entertainment, agriculture, history, religion, family, and technology. Focus on Liberia uncovers and showcases the best of Liberia and shows the world the truth about Liberia. We educate, elevate, and promote all things Liberia. We conduct interviews, panel discussions, debates, and more. Tune in to Focus on Liberia on Facebook and YouTube and be a part of the stories that make up the news.
This is Focus on Liberia, and I am Dennis Ja.
Welcome back. We want to thank all of you for coming, and thank our viewers for staying here with us on this COVID-19 special. Let's get your final statement. What do we do now? What's your advice? How do we improve the system? What needs to change? And how can you help? Let me start with Abby.
Oh, okay. For those who are saying that we need to help more or do this come back to the fact that there's this saying that not everybody can be on the mission field. So I have a friend who take health professionals back every 2 years, just as like who you don't mind me calling his name. I contribute to that. I contribute to many other charities that people will say, oh, I'm having this thing, I'm having that thing, I'm contributing to that. I can't be the one going there yet. So for those of us who are over here, we're doing our part. Not everybody can be on the mission field. So that's the part I want to talk about. And I'm willing to get on online if it's outside, if it's not going to be interfering in my work schedule. I'm willing to get on whatever website they want me to get on and talk about it, and they have to be willing to accept not constructive criticism. I'm not going to go in there and start insulting anybody, and everybody who knows me knows that's not my style. I'll keep it professional, just like how I keep it professional over here. But if you're coming to the table with preconceived notions about me, that's going to leave you, that's going to block any kind of acceptance into what I have to say. And I don't know everything. I don't. Doctors, the best doctors and the best, people in the world don't know everything. We're this whole COVID thing, we're all learning as we go along. We know a lot more today than we knew last year. So when we're coming from the fact of saying that, yes, we've gone through this, and these are the things that we learned, these are the mistakes that we made, and things that should be done this way. And when we say that, know that we're coming from a good place. I always tell people, I love Liberia, that's my homeland. But when I see things that need to be fixed, I'm going to talk about it, because I've been talking about it long before. This is not just today, and I'm not bringing anybody down, but I just don't believe in mediocrity. I don't.
Thank you. Dr. Golafale.
Yeah, thank you for having me on this show and sharing my experience. A couple of key things that we need to take into consideration. I follow the National Public Health Institute data on a day-to-day basis, and when June ended, I took the data and compared it to that of last year June. This year June, the confirmed cases was around 1,500, and out of the 1,500, we had 36 confirmed COVID deaths. Compared to last year June, we had 480 cases and 10 confirmed deaths, according to the National Public Health Institute of Liberia. And that put the case fatality rate at 2.2 in for this year, and last year was 2.0. The case fatality is, for public health people will tell you, is the ratio of confirmed diagnosed cases to death. So according to the John Hopkins COVID Information Resource Center, which align with what the MPhil is showing up, Liberia is right down overall since COVID outbreak. Liberia case fatality ratio is 2.9. It's the 4th in West Africa, and the highest in the MRU, Mana River Union region. And Sierra Leone is around 1.8, Guinea is 0.7%. So if we look at last year, by this time we're on a lockdown state of emergency, schools were closed, but it's the opposite this time, where we see our number of cases are on the increase. So it just contradicts what the policymakers or the leadership in general is their whole goal about fighting COVID. If last year we had a low case fatality ratio compared to this year, why are we still opening schools? Why are schools still open and there's no there's no eagerness to fight the disease with coming up with public health measures, the lockdown, cut down number of staff that go in public buildings and all that? I think the government needs to be serious about that, and because there's a chain of local transmission going on seriously, I believe, and in order to cut that down, you have to take up strong measures like you did, last year. And comparing the two times, the same time this year, last year about this time we had a lockdown, state of emergency. So I think those are some of the things that the government needs to speak seriously to. And in terms of the issue of the vaccine, hesitancy and misconceptions, the leadership plays a key role in this. We've seen other political leaders taking the vaccine right in Liberia, and Joe Boakai did it. His wife, Mr. Comey, has done it. I think the president needs to step forward because a lot of people look up to him. He has to, if he has done the vaccine quietly or secretly, I mean, let them show it out that he's done the vaccine. Then to give some confidence to people, they said he should be the first person that should have taken the vaccine. Like, you know, and sadly we haven't seen it if he has done it. But another thing is that the issue of ensuring confidence in our test system and sample collection and all that. There has to be high priority placed on quality assurance and ensuring quality control and quality improvement in the process. And I'm not a public health or medical personnel, but if expertise are needed in that area of how we can improve processes, we can help to give our opinion on that and give our input. And I know there are a lot of people in Liberia who can do that, but you just need to give them the support to do that. But overall, Liberia, I think there's a serious challenge in a lot of areas that we need to pay keen attention. And this show alone, we can't talk everything. But I thank you for the opportunity for me sharing my experience. COVID is real. Go and take your vaccine. Use face masks, avoid public gathering, and try to sanitize, wash your hand as much as you can, protect your family, speak to them about COVID, and let's keep each and everyone safe. And let's be transparent in everything we do. That's how we're going to fight this disease. Be honest and transparent. Ensure that there's accountability, whether in government or private sector. Mr. Ja, Ms. Tyler, thank you all for this very interesting conversation.
Thank you so much. And on Thursday, we're going to come to the politics of it. COVID-19 level 4 and the Equality Forum, that's in France. This will happen on Tough Talking Thursday, where we're going to discuss the rise in the COVID numbers, the death, leadership or the lack thereof, accountability, and the politics of COVID-19. We're also going to be talking about the Paris Generation Equality Forum attended by President Weah and team. And we're going to have FOL Chief Political Analyst, Mr. Wilmot Cooney, the Director General of the Liberian News Agency, Kwame Weeks. We're going to have public policy professional call, our political commentator, Mohammed Sharif, and also Wede Power, who's an organizational development and change management expert. You don't want to miss the politics of COVID-19. Today, we're not talking the politics. That's why we see it. We're talking soft, but we're going to talk tough on COVID-19 politics. On that note, my name is Dennis Ja. On behalf of the team, saying thanks for watching.
People who do this work out of the conversations of the politics, people who are hands-on doing this work, the things are not going to change. It's the same thing in America. We say that you can't make laws in Harrisburg, which is Pennsylvania, or make laws in DC and not involve the people who do this work.
Yeah.
That's why our nurses association have political action committees, the NPs, the doctors, all of them. They're heavily involved in the political part of this. You have to involve those people in, but when you take us out of there and say, no, you just stay there and just talk about this, and we'll need you, we'll call you in. Okay. But anyways, thanks for having me, though.
Hats up to all the nurses and healthcare workers. Hats up to you people. Thank you for your hard work in Liberia and everywhere around the world.
Everywhere around the world.
On that note, whether you believe COVID exists or not, whether you took your vaccine or not, one thing to remember, we are all Liberians, and we must do our best to keep our country safe. Have a good day.
We are Liberians.